Hey, thanks for coming back. As you can see, if you're listening on the radio, this is on YouTube, so you can listen to it. But I am doing an interview. You can see it right next to me. Is Dr. Rajeev Fernando is back on with me. Welcome back, Doctor.
Sean, it's wonderful to be on the show. Thanks for having me.
Thank you. So I want to introduce you as you sit there for a second. Dr. Fernando is an infectious disease expert. He practices at a hospital in Long Island, New York. He also has his own charity, which is Shiraj.com is where you can get it. Did I pronounce that right, Dr. Fernando? Shiraj? It's named
absolutely.
after his parents, and we're going to let you talk about what that is. But I also want people to know that Dr. Fernando is board certified by the American Board of Internal Medicine, including its infectious disease division. He's also worked with Doctors Without Borders. And right now, we're going to talk about it. He's going around the country. You can see he's wearing a mask. He has these very cool masks, and there's a reason he's doing that. And today, we're going to do a little update. The last time he was on, we just wanted to know what the heck was going on. We were kind of new to the COVID world, and I wanted to have him back on so we can get kind of updated. Where are things today? Now, just for the listeners, this is going out on the radio, WSMN 1590 and 95.3 FM. We now have the same station as both AM and FM, so that's kind of cool. Southern New Hampshire, Northern Boston, goes out onto the podcast circuit through Spotify and iTunes and all those, and as well as YouTube, because we're videoing this. So if you're listening to it, just know that there is a video if you do want to go watch it. So, all right, there it is. Dr. Fernando, thank you for coming on and talking to us. Tell us what you've been up to recently, because you're this mask. Tell us about the mask.
Yeah, so what we realize is prevention is one of the most important things right now for COVID-19. And we've seen this trend very often where people just don't want to wear masks or social distance. And these are very common issues. Unfortunately, wearing a mask has become political. So certain people want to wear it. Some say, no, I want to keep my freedom. I can't wear it. So what I've tried to do is make these masks cool, which is so people say, let me put on my mask before I go to work or go out. So for example, I've been touring the country. Last weekend, we were in Washington, D.C. At the White House, and a lot of youngsters were not wearing masks over there. So in order to facilitate the peaceful protest, I actually made out George Floyd masks. So people over there, they said, yes, this is what we're here for. We're talking about this. So I made my masks with George Floyd. So people saw this and say, hey, yeah, let's do it. It's a cool thing to do. And that's what I'm trying to change the nature, especially with the youth. It's very difficult for them to get them to wear a mask because they don't realize it. A lot of people in the country, these kids are having COVID-19 parties to see who's going to get COVID-19 first. So that's we really have to target the youth with this.
All right, I haven't heard that one, but so tell me about the mask, because it is. I know it's become political, unfortunately, but it's important to know the science behind it. Can you talk a bit about the science behind wearing masks?
Of course. So in my opinion, these viruses, they're two spreads, and we'll talk a little bit about the newer one, the airborne. For the most part, what we've known for the past couple of months these are respiratory viruses, which actually, when you cough out these particles, they go to a distance of about 6 feet. So that's the data that we have right now. And one of these type of masks that you wear actually prevents that. So when you're actually coughing, this barrier over here prevents that from going to the next person. So it's very, very important. And I think what's really important is sometimes it's you're doing it for the other person, not for yourself. Remember, you have other immune compromised people out there, elderly people out there walking the streets. So it's not for you. Let's not be selfish. Let's protect the other person. That's why this is so important. Now we're learning. Sorry, go ahead.
No, go ahead. No, I'm interested in that. I have questions always. I always have questions, but keep going.
That's why I'm here. Can't wait to answer them.
Okay.
And now we're learning that there's new airborne spread, which means that the virus can travel up to anywhere between 25 to 30 feet. So that's something that's in the works right now. The WHO is investigating that, but that could be a whole game changer with that kind of, if it spreads that far, we're going to need different masks. So that's in wheels right now.
Yeah, I have read that as well, and I know there is investigation going on. Unfortunately, there's so many things that we hear through all this, and then some of them don't turn out to be true. I try not to push that kind of line until we know for sure. But we do know, okay, so we get that the masks are really to protect others. Is it doing much for us to prevent us from breathing in the virus? Masks
Absolutely. This doesn't do anything for yourself. This really is to
for
protect
the
the other
others.
people. And also, yeah, that is the most important thing of the mask, which is that's why I say when people say, I want my democracy, I said, forget about your democracy, keep other people safe. And that's the most important function of wearing these masks outside.
Yeah, fair enough. So you brought up the protests, and I don't know if there's been a study done, but I got to tell you, it was pretty rough watching on TV the amount of people gathered in tight areas, and in some places, absolutely no masks. Some people wearing masks, and I don't know if there's been that study done yet of what happened infection-wise within any of the protests. Any news on that you have? Have you seen anything come out on that?
Yeah, that's an interesting point. So, the infectious disease doctors, we followed all these cases, and remember the incubation period of COVID-19 is about 14 days. So it's been weeks since the protests have happened, and we really haven't seen those cases rise that we expected to. So some of the hypotheses I think are a lot of people were wearing masks at these events, which protected a lot of people. And the other thing, which is why I was talking about airborne, is people who are outside. When you're outside and you're walking, it's very difficult because you have fresh air. Whatever you cough also just it gets taken away, it gets blown away. And that's why I think this concept, people always ask me the difference of saying, well, why do people outside don't get it and why are people in the bars not getting it? So take it this way. Let's say someone is sitting on one corner of the bar, and let's say point A, and then you have point Z. So why is point Z getting the virus when he's all the way at one end, and point A, that person had COVID-19? It's more than 6 feet. So the concept over here is in closed spaces. We have a lot of people in closed spaces. That's when the virus can actually go airborne. Now, outside, these airborne transmission isn't that common because you've got fresh air moving all the time. It's these closed spaces where the ventilation isn't well. A lot of people in a closed space, so you can get the virus from point A going all the way to point Z, and that really represents airborne transmission.
Yeah, we'll have to learn more about that.
Of
Now,
course, of course.
we do have a spike happening, obviously, in cases right now. Just for the what date are we on? Just so the listeners know, we're on Friday, July 10th. Just so anybody listening to this, you can look back and go, oh, that was that date. We have a spike going on in a number of states. And you had just mentioned, you're not people. They haven't seen the spike come from the protests. It's been a couple of weeks or 3 weeks. But at the same time, we are having a spike happening, and I don't know if anyone knows yet. There's these interesting studies that happen following phones. I don't know if you've seen any of these things. New York Times does this pretty well. They get the data of phones in a certain area, and then they can track those. They don't necessarily know who that person is, but they track it around. It'd be interesting to see all the phones, mobile phones, in a certain protest, and then you can trace back potentially who got the virus. Anyway, there could be a study done. I don't know if it's been done. But when you say we're not seeing it, we are seeing a spike in cases, not necessarily from the protests.
So the spikes in cases are clear. The reason it's happening is cities or states were reopening not based on science and epidemiology. They just, well, let's do it. Let's just open it. Time to open up. Let's open it. And so anytime a state reopens, it should be based on science and epidemiology. So take the epidemiologists, their data very seriously, because now, for example, when you get a case of COVID-19, you get a case right now, it's counted as a case, but it really, in my opinion, by treating a lot of these patients, they go on a ventilator, but they don't die right away. They take about 2 weeks, sometimes 3 weeks. So you're going to see a lag in the number of deaths of cases. It's going to take a few weeks. So that's important to understand. With regards to contact tracing, it's really going to be impossible to do in states like Florida, Arizona, and Texas. It's just impossible to get accurate readings right now. I would say doing contact tracing in New York, it's going to be much, much easier. The cases are down. You're able to contact trace, but it's not going to happen right now in these places. And these places, they've just opened up. I'm very concerned that Disneyland is actually opening up. Disneyland, Universal, SeaWorld. Once again, we're going to have problems here. You're just opening based on no fact or figures. You're just saying it's time to open up. when hospitals in Florida and Houston are just running out of ICU beds. So that's pretty irresponsible, if you ask me.
Yeah, you also have California though that opened up, and they were, I think, following pretty closely the epidemiological,
Yeah, yeah,
study, everything about that, and and it's spiking in California too. It
yeah.
feels a little, it's easy to jump because this is political. There's a lot of politics when you throw in Florida and Texas,
Yeah.
being a more red states, more Republican leaning. It's easy to go, oh, those darn Republicans in that Trump world, they're just trying to go out there but you also have California that is
Great
spiking
point.
pretty dramatically too. So I just want to make sure for you, you and I didn't talk about this off air, but my show, we try to be as neutral as possible,
Of
regardless
course.
of what the politics are, trying to look at the science.
I'm in complete agreement with you. As an infectious disease doctor, I'm here to just explain the science, not put out any sort of political thing. And you're absolutely right. It's a very good point you bring up about California. California was very, very strict. They followed all the rules, and yeah, they opened up and they started seeing cases. So a lot of times, in my opinion, you do everything right. Like you pointed out, great example with California. They did everything right. When they opened up, they started getting cases again. So I like to look at this in a different system, which is like a red light, a yellow light, and a green light. So I like the concept of sliding through the lights as necessary. So let's say you open up, you try it, and it's not working out. You go back to yellow in the calm situation. And really, the only way to really slow this down when you're in a situation like this in California or Texas or Florida, you got to shut down. You talk about masks, you talk about social distancing, but nothing trumps locking the place down. Nothing will trump that. So we've
Well,
had
of course.
successful stories out there. And I think this is the time where governors have got to say, listen, we are in a lot of problem over here. Like I said, the cases you're seeing right now, the highest number of cases, but but remember the deaths are only are going to show in 2 to 3 weeks, because that's how long, in my professional opinion, I see patients get put on a ventilator. Really, they hang on for a while. We try all kinds of things. And it's really about 2 weeks later when you actually see the death. So the death is lagging behind the actual number of infections.
Yeah, and we've had the uptick now for I think a couple weeks. We're going to see in the next couple weeks what's happening with deaths. Now, and I have there's a couple questions I have, but let's just hit the first one. The trouble with here's my problem. We've got to have the country go forward at some point, or the cliff we fall off of financially is going to be worse than anything that we have. So I just can't figure out where that balance is. We open up, things are starting to move, the economy starts coming back, and then we have more infections. So, do you have any thought on where are we ever going to get that balance? Because we've got to have, otherwise people are going to run out of money, and there's going to be suicides. There's going to be all sorts of mental health issues. There's going to be, and there already is. I mean, this is a very stressful situation as it is. So I'm trying to wonder if you have any thought on where we hit that balance.
Yeah, I love your discussion right now. And this is the exact discussion I had a few months ago when I said, where's this going to come from? But the thing is, what we have to think of, the more we're opening up without using science, in the long term, these jobs are really going to get affected. We're talking about permanent. Now, let's say you have a job at a restaurant. The restaurant owner says, okay, we're going to calm down. We got to close down. When things get better, we'll open up. But when you open up and then close again, things get a lot worse. And all of a sudden, you just don't have a job. So I feel in this kind of a situation, the government has really got to come through with stimulus checks. We don't have an option over here. They have to come through. Once again, no political agenda over here. But this is it. And I personally feel we're just at the sort of beginning, if it sounds ridiculous, but I think unless we get a vaccine, soon, this is, going to keep infecting and infecting. It's not going to stop. So I feel like, we really have to think about things like a lockdown and get the government to do stimulus checks. Easier said than done, but that's what the science of this virus is telling you.
Yeah, certainly not that hard to get. It doesn't seem to be that hard to get the government to start writing trillion-dollar checks. They've been eager to do that. The problem will be eventually the money becomes worthless if you just keep doing that forever without some production happening.
Yeah.
So you mentioned the vaccine. I'm curious. I've heard, you aren't going to be able to get a vaccine for this kind of virus. It mutates. It's not going to work. And then there's those who think that that's the ultimate solution. Where are you at with this at this point?
So I think we've learned a lot. Now, I was in New York, and New York, that's why sometimes it really upsets me when people haven't learned from New York. New York was the first place, and I was practicing in the epicenter in Queens, and we just had curveballs thrown at us every single day. So it kind of upsets me when the rest of the country, after seeing New York get beat up so badly, that they haven't taken the cue. But we've learned a lot since New York. We have some treatment out there. We know steroids decrease mortality in about 35% of cases in the ICU and 20% of patients with pneumonia. So we made strides forward. We have some therapy. Remdesivir is a drug out there. Not the best of what I can say, but I think it definitely helps shorten the period. So we've got different medications out there to help, which we didn't have in March. In March, April, we were scratching our heads. We actually used hydroxychloroquine, azithromycin. Now we know it actually increases mortality. So within a week, I stopped that. I said, because doctors want to give something. We just can't stand and watch our patients die. We're like, let's try this, let's try that, and things of that. But thinking forward, I think we've really advanced. But this is we're not advanced enough. And with regards to a vaccine, I think you're right. We're months away from getting a vaccine. And one of my big concerns, like the global leader right now, is the Oxford University in the UK with coming up with a vaccine. And my concern is with the US actually distancing itself from the rest of the world with the WHO and things like that. If the rest of the world comes up with a vaccine, how do Americans get it? Are they going to prioritize us? Now, we do know that 15% of the WHO its activities are funded by the United States. But what will happen if which we've already distanced ourselves, are Americans going to get the preference or priority? So it's a lot to be learned. We have vaccine candidates from all over the world. In my experience, the Oxford University, they're on top of this. They're probably the fastest. We have some in America, of course, but it's going to be a while before we get a vaccine, to be quite honest with you.
And you think it'll work? I mean, this kind of virus, we will be able to get a vaccine?
Yeah, the thing is, what happens is, if it depends on the amount of mutations. Now, for example, we have what's called the Wuhan strain, which is the first strain. It really circulated around Europe. It circulated around Asia, excuse me. And then following that, we had the Italian strain, which tend to cause more severe disease. And that's what we got in the States. Now it's really possible that there's a Florida strain, a Texas strain, a California strain. So the virus keeps mutating every couple of weeks, all the time. But the question is, how big are the mutations? There are tiny mutations which really don't affect the virus itself. Small mutations. It really hasn't changed the characteristic of the virus. But when you have the big mutations, that's when the problem comes in. With the vaccine is going to target these new mutations. That's the problem. And that's why, quite frankly, to be honest with you, it's the hardest thing on earth for me to sell a flu vaccine to a patient, because the efficacy rate isn't great. It's sometimes as low as 30%, but flu, it just kills 0.1% of its patients. But this is a much more deadlier virus, so it will have bigger consequences.
Well, with the mutations, is it a standard practice that we've learned with these kind of viruses that over time they mutate to become less severe? Because if they're severe, if they were severe, they kill the host, they're dead too. So you would think that the milder ones would eventually live because they don't want their host necessarily to die.
You're absolutely right. I love your thought process going into this. And this is exactly what happened in 1918 when you saw the second surge. You had a lot more cases, but the patients weren't sick enough. So that's what I'm hoping with this. But this is not a second spike. We're still in the first wave right now. This isn't a second wave. We're still in the first wave, trying to fight through it.
Yeah, we're going to see what happens. I've been telling my listeners the next couple of weeks really will be key to see what happens with the death rate. We have a couple of things happening, and I hear what you're saying on the mutations, not enough yet. I mean, you know better than I, so I don't know about that. But we certainly have come up with more treatments, as you just kind of laid out, as well as proning. Is proning still found to be of help?
Absolutely. And this is something we all learned as clinicians during this period. We learned about proning, which helps so much. And we also learned about delaying intubation, which means we try to keep the patient without being put on a ventilation. There's something which we call high flow oxygen, which is we're allowed to give the same amount of oxygen just through something like a mask instead of putting a patient on mechanical ventilation. So we try to delay the intubation as long as we can. And these are tricks that we've learned, through managing some of the most complex patients. We had no experience whatsoever. So yeah, I'm really happy. Like, physicians are much more experienced, nurses are experienced, and they've followed the data across the country. They've seen what all of us have done, not to point to myself, but what many doctors in New York have done, and that's sort of becoming the gold standard right now.
Yeah, that's my hope. My hope, of course, is that we do have more cases. I get it. But let's see if we can keep the mortality rate down by changing some of our methods. We didn't know a lot of these things early on, especially that intubation. I've been with a friend that had been intubated. It's a pretty severe, it's pretty intense. I mean, you have to put the person under into an induced coma. I mean, it's invasive.
Yeah, yeah. And then it becomes hard, Sean. Once they're on mechanical ventilation, sometimes it's very hard to get them off a ventilator. So that's why
Right.
we try our best to give this high flow oxygen through a mask and try to prevent intubation.
And they're still awake though, right?
Yeah, it depends. So a lot of times for us, the younger people are the ones who are fighting the ventilator. They wake up and say, "What's going on over here?" They try to pull it out, and it's interesting when you see these youngsters pull out the tube. Within seconds, I see them get all blue. So that just tells you this is a real problem with oxygenation. They turn blue within seconds, and we have to reintubate them right away. So there's so many things we've learned about this virus. And the other thing I want to tell people out there is we've learned that this is more a vasculitis condition, not just the lung. This is a multi-system involvement where it invades the blood vessels, forming clots all over the body, going to the brain, going to the heart, going to the kidney. It's a multi-system involvement. So I try to tell physicians all over the country that don't just focus on the lungs, because that's when we'll be losing. While you focus on the lung and say, "Oh, he doesn't have a pneumonia, everything's okay." Meanwhile, his kidneys are shutting down, and that's something we got to be more vigilant about.
That sounds like we're into sepsis at that point. Is that the actually what's shutting down? If they're shutting down kidneys and other organs, we're now maybe getting into acute sepsis.
I'm so happy you're so well read with this topic, and it's a real joy to talk to you. You're absolutely right. That's what's called multi-organ failure. But a lot of times, like say the first time I saw this young Hispanic gentleman, yeah, he'd come in with some weakness. Really, just it didn't really make sense. He's 40 years old, came in with some weakness, and his lungs are clear. When I was listening to his lungs were clear. And then soon we sent out because he was coming from a COVID endemic area, and he only had a stroke, which is because of COVID, actually. So you have to really think out of the box in these kind of situations. We've seen kidney injury, it can be part of the global sepsis syndrome, like you say, septic shock, but it can also happen isolated. So always look, for different syndromes. And if they're coming from a COVID endemic area, definitely think of COVID as a culprit.
Interesting. Yeah, I had a friend who went into septic shock. I unfortunately am very well versed in it. I had to be intubated and was in a coma for several weeks. Anyway, so I'm very familiar with that. Unfortunately, so now lack of oxygen. There are reports that monitoring oxygen, even simply those things that you put on the end of your finger to watch your oxygen level in your blood, is also smart. Somewhere I read that a doctor was highly advising that. I'm not sure you and I spoke about that before. Is that also a good way for a physician, or even at home, if you're not feeling right, to watch your oxygen levels?
I don't mean to put any panic into the public or people at home, but certainly in a hospital setting, a lot of times, sometimes people look well. They're sitting down, they're relaxing, but that's a great tool of checking someone's oxygen level. The only thing to remember is if one is wearing nail polish, it's not going to give you an accurate read. But certainly, I think it's a very good, and that's why when someone's in the hospital, we check vital signs like every 4 hours. And that could be a sign. So I'm glad you brought that up. So someone who has low oxygen levels, even if they're not short of breath, they seem comfortable, this may be an ominous sign of what's to come. It just shows you other physical exam findings. You see someone with a bluish hue, a tongue which is bluish, And those are signs which we quickly pick up and say, well, you look okay right now, but these are the patients you want to watch closely because they could go into acute respiratory failure very quickly.
Yeah, I heard that about COVID, that when it gets into your respiratory area, that you may not actually, like you just said, you may not feel it too bad, but your oxygen levels actually dropping. And so I'm, hey, just so you know, everybody, we got one of those little things they
Yeah,
stick on at my house.
great.
So we
I can't,
got one.
yeah, I can't tell you the number of people who come in, let's say they have belly pain and they have diarrhea. COVID invades the GI tract and causes diarrhea. So when you're getting a CAT scan of the abdomen, you get a lot of times you get the base of the lungs and you see clear cut COVID of the lungs, but the patient is not symptomatic at all.
They
So
don't
they
feel it.
still have pneumonias. And that's why I like good question you posed about monitoring oxygen levels.
Yeah. Okay, good. So I just want to swing back. The pressurized oxygen versus the intubation, those that are getting the more high pressure oxygen, they're awake. You don't have to
That's correct.
sedate them. Is that right? Okay.
No,
Just want to make sure
absolutely
we
not.
have that clear.
Yeah, yeah.
Now, the other thing I've noticed, the New York Times does a really good job of tracking the cases and deaths across. They have a whole unit that just does that. And the other day I was reading that they've isolated that 42% of the deaths in the US have come from long-term care, old folks' homes, that type of thing. Now, they've isolated 42%. So again, I'm always the optimist. I'm trying to figure out how the heck we get out of this situation. First of all, we
Yeah.
have the new treatments. We have proning. And actually, before we go on, because I like people to understand what we're talking about, explain what proning is, and then I'll finish my statement.
Sure. Proning is when you lie down in a prone position. You have prone position and supine. Prone position is when you lie down forward. We think there's more recruitment of oxygen through the arterioles. There's more oxygen coming in that way. When you lie backwards, that's a supine position. So when you're lying prone, we think there's more recruitment of alveoli, and that gets more oxygen into the thing. So proning is very, very important. Like you said, these are tricks that we learned only during the acute crisis in New York.
Yeah, that's good. And if you go online to listeners and Google that, proning pads, proning pillows, proning COVID, any of that, you're going to come up with videos and all sorts of stuff because there's special equipment to allow people to do that. Okay, so to finish my statement, we have these different things that we've learned. We now have seen just from statistics that 42% so far has come from a certain sector. If we make sure that we protect that sector, we continue trying to utilize the techniques that we've had. Heck, there's really nothing else to say here. That my hope is that even with the everything rising, we're not going to see the kind of spikes in deaths that we did before, especially in New York.
Yeah, New York has done very well. They've been very careful about reopening. The thing is, what I always tell people is we're just one super spreader away from actually getting this whole thing started again. So it really takes, and it's been very strict, and I'm in agreement with the governor where we blocked about 20 states of people coming from 20 states into New York because they realize New York is a hot zone. Remember, we're in Manhattan, space is so small and people live in congested houses. So all it takes is for one of these super spreaders. A super spreader is one who actually comes in and can infect up to 15 people in one setting at a party, and there we go. That's how everything gets started. So New York is very high risk. So I think we've done a great job right now, but whenever I talk to people in New York, I say we're doing okay now. Let's keep what we're doing. It's not a time. I know there's a mask fatigue. People don't want to wear masks. It's tired. Everyone wants to go to the beach. Imagine going to the beach with a mask on. These are all new things. But I always tell people, it's a matter of life versus livelihood. Which one are you able to balance? If you want to live, these are your livelihood. You have to sacrifice some of your livelihood in order to live. So it's hard, and there's a lot of fatigue. And I'm glad you brought up the point of mental hygiene, which is very important. In order to buy these masks and sell them out, they're about $6 a pop, but I donate it to people who need it. So in order to do that, I do work some overtime shifts and in a detox facility. And I can't tell you the number of admissions I'm having with overdoses, with alcoholism. And what's happened is people who go to their regular AA meetings, it just shut down during the pandemic. And these people were, highly motivated. I really respect them, doing great, going for their meetings. suddenly shut down, and they tell me, Dr. Fernando, I was doing great. I was in remission for months. No one to talk to, no one to guide me. Bang, you're in the hospital with alcohol withdrawal. So these are really, really big problems. We haven't been spending enough time talking about it, but there's going to be a huge need for psychiatrists to step up to the plate over here in the next coming months.
Yeah, I got to say, I'm not. There's not a fan of psychiatry because of the amount of drugs they pump out. To be honest with you, but
Yeah,
mental health, absolutely. Just to back up again, I have a question. We'll come back. Super spreaders, you can't tell who they are. I mean, no
can.
way to even understand who they are. It just happens. Is that right? That's.
You can't tell that, and that's why. Let's say, for example, a patient. Let's say you have a super spreader. Let's say you have a room with a crowded room with many people. One infected person of measles can infect anywhere between 12 to 18 people in an hour just by being in a closed room. And people, obviously, the 18 people shouldn't have had the vaccine, but that's what a super spreader is.
Okay, it
So
just happens.
it just happens. You really can't pick who's the one who's going to be it.
All right, let's swing back to I think it's an important topic. I would, I've read, I watch some of these statistics. I get this incredible, email every day and they have these graphs. I just love graphs. I'm always visual. And there was one about the amount of alcohol consumption and purchasing that has happened since COVID. There are absolutely people sitting at home drinking, probably where they wouldn't have been before. So I'm sure we're going to have much more drinking related situations. And that's a little bit of a bug for me. I'm glad we talked about this because, you see the amount of deaths happening from COVID, but we don't see other things that are actually happening. We're so focused on COVID and we have to stay shut down. And I'm not against shutdown. I don't want people to die. And in fact, I was going to say to you, it's really easy to wear a mask. I mean, it's a simple tool that can be used to help people. I get it. But at the same time, we have this balance. And I don't feel like our government, I haven't found yet a government that has done a good job on the balance, at least here in the U.S., not going outside the U.S. But the balance of how do we keep everything going for everybody while we're trying to protect people from dying from COVID, because we're going to have deaths from suicide. You lock people in a house, they can't go anywhere. They can't even see anybody and they're freaked out and they already have mental instability. It'll be interesting to see the amount of suicides that went up potentially during this time, the amount of other deaths that happen because of the crazy things that people are drinking and whatnot. So, this is a frustration that I'm sure I'm not the only one. Where's that darn balance? Somewhere we've got to get to that balance.
I think so. It's a very, very hard situation. And I really foresee this pandemic going well into 2021. Actually, it's going to be for a while. And I'm glad you brought that up. Besides alcoholism, so much of domestic abuse that's going on. And quite simply, we haven't spoken about a very important thing, starvation. There's so much of starvation across the planet. And even in the US,
Yeah.
1 in 6 kids don't get a proper meal. So this is just going to keep getting worse and worse. The big thing I want to mention is vaccines. People are not getting their vaccines. And a lot of times, unfortunately, the primary care doctors say we're closed because there's a lot of telemedicine going on. Well, telemedicine, you can actually talk to the patient, communicate, discuss a consultation, but you can't get a vaccine through telemedicine. So our basic vaccinations are all down, and this is going to be a big problem.
Well, very good points. I spoke to a specialist on my show a couple of weeks ago, and his concern was he was a superintendent of a school as well as a police officer. So he was in a smaller town in southern Illinois. He does both. He's a superintendent over a school. He's also a police officer. His big concern is these kids that go into homes, they don't maybe have food because schools provide a lot of food. So they are providing food, but also abuse. So you have kids going back into homes that potentially it's abusive. The parents are stressed. And you mentioned domestic abuse for adults as well. There's a lot going on here that, unfortunately to me, is not being talked about equally or even close to any kind of factor. It's all the headlines. And I know that the press, I talk a lot about the press. I'm not a big fan, honestly, because they're looking for clicks. They're looking for eyeballs, and they need to make sure that what they're reporting in a lot of cases is a little bit dramatic or a lot dramatic, and you want to click and you want to learn and you need to understand. But we're focused so on COVID that we're missing, in my opinion, very important stories that are happening out there.
Yeah, absolutely. Very well said. And I think everyone is just fixated on the number of cases, but they're not talking about the consequences beyond what are the things, how COVID-19 is really changing lives besides life and death and number of infections and number of deaths. There's so many problems. It's just unbelievable. Let's say someone has COVID-19, like nurses, for example, they can't go home. Children, I mean, everyone's stressed about going home. And my other big concern, Sean, is the healthcare. We're all ready for another. If this happens again, we will go right to the front lines. We'll do it. I will die for my patients. Quite simple. When I worked in, Doctors Without Borders, we do everything for our patient. Nothing stops us. Our patient is the most important thing. But a lot of times, I think in this situation, the mind is willing, but the flesh may not be willing. So even New Yorkers, New York doctors, nurses, a lot of them are having, post-traumatic stress syndrome from before. A lot of times they're going into battle, they don't have the proper PPEs, and it's just very stressful for a lot of people. So, I'm very concerned about healthcare professionals if we have to go through this again. Like I said, we'll be there, standing and fighting for our patient, but mental fatigue is definitely gonna come through, I think.
Definitely. I just want to thank you while you say that. Thank you for being out there and helping, because without the healthcare professionals, I'm not one, we would be in serious trouble. So I appreciate your work.
It's an honor to serve the people. Thank you for saying that. It's very nice of you.
Yeah, and I would think that it would feel good that you have the tools and knowledge to help people. And that part I would think must feel good for you.
I honestly, I teach my students and my residents every day, and honestly, it's just a joy. Infectious disease is a lot of mysteries, like why is this happening? How is it happening? And it's a jigsaw puzzle for me every day when we solve these cases. And I can't believe I get paid for it. It's just such a joy, and helping people and keeping them going is just, I really can't explain it. It's such a fantastic feeling inside, and people are so grateful. It's just a joy to be a physician. I can't say it. It's just a joy. And we rise to the occasion when people are dying. It's a pleasure. There are risks, I feel, in everything. When you go to NASA, when you go into space,
Yeah.
there are risks. There are risks for every profession. And, it's a joy to be here. Thank you.
I love to hear that. To give back is amazing, and it's frustrating for people like me. I own a company where we fabricate things for trade shows, so you can imagine our business is tanked at the moment. So it's frustrating that the tools that we have, we can help. We've made COVID signs. We've done COVID signs for all the stuff in Los Angeles, and we can help in that way. But having the kind of tools that you have must be really incredible. So very well done. A couple more questions before we end off. Testing. There's a lot of testing happening. It seems like if we have good testing, rapid testing, accurate testing, once people understand they have it, they can quarantine, and we might be able to stop the infection rate from flowing around. Is that right? Is if we have enough testing, we can ideally start getting people out, and so it doesn't spread so fast?
So we have two testing. One is the rapid, like you said, that you test the nose, you test in the oral cavity, in the nasopharynx, and this tells you whether you have an acute infection or not. Done. I love the testing. Any good company in the market these days should have a 99 or 98% success rate. If I have that test, I'm going to believe it. So back in February when we came out, we had these lousy tests, which says it's only right in about 60% of the cases, and we didn't know. So a lot of times, my take in life when I teach my students is if it looks like a duck and sounds like a duck, it's a duck. Don't believe any test. You're the physician, you're the clinician in front of the patient. So a lot of tests were false. But right now, as long as the person is doing the test appropriately, and I always tell people when they come out after the test, did you feel uncomfortable? And if the patient tells me, I didn't feel anything, doc, it means the test wasn't done properly. So you really have to go into the back of the nasal cavity to get this test. But as long as the test was done appropriately, they're great tests. They will diagnose an acute infection. The antibody test has been a big failure so far.
Let's talk about that.
Sure. So the antibody test really, a couple of things I will say. So traditionally, when you have an antibody test, let's say you go for a new job, you start a new job, and they say, well, Sean, I want you to check your measles titers, your mumps titers, and you do the test, and it comes back. You see the value, you're like, all right, we're good. They're gonna be like, Sean, you're ready to go. Start the Sean Burke show because you have slam dunk levels. I'm never gonna worry about this. Now with COVID-19, we don't know what that level of immunity is. We know it's positive, but we don't know what is that magic number to say you're safe. We don't have that number right now. And the other thing is we don't even know how long this immunity will last. People say it's 2 to 3 months. So I always say, well, just check it every 2 3 months. Because this tests are so flawed, I haven't even bothered to go get a serology test. You have to ask yourself yeah.
Well, what's up with that? I mean, we have a test to save whether we have it or not. Why is it being so difficult to get the antibody test right?
Yeah, we're still learning about the virus. That's the problem. And just to prefix that, like other viruses, like I said, a lot of times they confer lifelong immunity. But the coronaviruses, we have the SARS-CoV-1, the first SARS virus, only gave immunity for a year. And the other one, the Middle Eastern respiratory syndrome, also a type of coronavirus, giving it for less than a year as well. So these coronaviruses are very, very difficult to understand. And the thing is, those, of course, SARS, no one really studied enough because it was gone in a year. 10,000 cases done. I don't want to talk about it. It's gone. Let's not waste our time. MERS is a Middle Eastern respiratory viral syndrome. It didn't hit the rest of the world. So Europe didn't go crazy. The United States didn't go crazy about studying it. It was very largely limited to the Middle East. Didn't go anywhere else. So now we're stuck with really understanding these coronaviruses because we've just not seen it before, and we're really fighting to understand. People say there are reinfections, and that's the whole concern. When your antibody levels go low, there's reinfections, but I haven't seen that yet. I'm going to be upfront with you. That's what a lot of people are expecting, but I just haven't seen that. And also, we started off a little bit late in March, but December, January is when China started. They haven't given us any data on reinfection, so it's jury's still out there on this reinfection concept.
Let's go. Let's not have reinfection. I feel like if we're gonna rig the game, okay, no reinfection, no over here. We got to have some way out of this. That's the thing. I still, at some point, humanity survives. Humanity figures this out.
Yes.
What that is, I'm not sure. And again, the next 2 weeks, we're going to see what happens with the death rates with all these spiking happening. That's going to be a test.
Yeah.
And I know that they're working on that vaccine, and there's so many trials. There's probably in history never been more trials going on at one time for drugs and for other stuff. I know there's a ton happening. The world is trying to figure this out, and we're smart. Humans, in the end, we're smart. We're going to figure this out, or the body itself is so resilient and strong, it'll figure it out. Some way we're going to get through this.
You just quoted one of my masks, which are humanity will prevail. And that's what all my masks are encouragement to say, listen, we can do this. Stay strong. Let's stay positive. We'll do this. And as a matter of fact, one of my masks are humanity will prevail. So you Love just it. Read my mind with one of my thoughts there.
Good. Well, you've been very helpful. Anything? I do have one more question. I have thought this morning, I haven't read anywhere. Have you gotten any final information on where the heck this virus came from? We've heard many ways that it was man-made, and it wasn't man-made. Do you know if there's a definitive ruling that's been done on that?
I don't think it's man-made because it's a great thought, obviously. But you see this virus, it's got a homology, which means more than 85% of the virus is exactly similar to the SARS virus, SARS-CoV-1, which happened in 2003. And this one, it has an 85% homology, which means it's almost identical. A couple of changes, of course. But not to sound political again, but I really think this is out of China. There is some data, and actually, as we speak, the WHO is actually planning, and they're going into China to find out the origins. But I strongly think this is from China, not to be political at all, but I really think it's from China. Remember, we think bats are culprits. So I think they can find this out of caves. That's what I really think we can do. And those are some of my thoughts.
Good, thank you. And I know it's certainly out of China, but could you not? And again, I have no opinion, and I've heard both sides. Could you not take a coronavirus and just alter it a little, like you said? Most of it's the same. And I'm talking man. Could we go and scientists alter it a little bit, and off it goes? And would we even be able to tell if this was man-made? I'm curious.
We can, and that's what
We
worries me.
can.
You have sick people out there who can totally take advantage of the situation. And remember,
Yeah.
mutations can weaken the virus or make the virus stronger. So you
Sure.
may have some sick people out there, and they can, change the whole virus itself, make changes, and use it, and even use it as an agent of bioterrorism. So you have these people out there. So, well, I don't think there's any reason for bioterrorism right now because the virus is just winning completely. But
Yeah.
thinking ahead, I always think of all the different possibilities because for me, seeing today is way too easy. It's always, as infectious disease doctors, even when I teach my students, it's like seeing today is easy. What do you think's going to happen in 3 days? And that's the way I train my students. So that's what we think of as infectious disease doctors.
Yeah, that's good. And I guess my question, just to clarify, because you're the expert, if it was man-made, would we be able to know by looking at the virus? You wouldn't be able to tell, right?
No, that's what I've mentioned, and I'm not an expert in that, but it's people in the lab who specialize in that. I've discussed with multiple people who do laboratory research and things of that. They say it's not. We have a different structure, and since I said we have 85% of the virus, which is similar to SARS-1, it's unlikely. But for me, to be honest with you, anything is possible in this situation. I don't want to
Sure.
flaunt any conspiracy theories or anything like that. But I have a lot of callers on my shows, and they say, "What do you think?" I said, "It's unlikely, but jury's not out yet.
Yeah,
It's unlikely."
and I'm not sure it was bio weapon or someone was playing with it and it got out. Who know? I don't know. This is definitely an interesting virus, and it has wreaked havoc on the planet. That's
Yeah.
for sure. So, last thoughts from you, Doctor?
We're going to be dealing with this for a while. So I think it's very hard, but we have to train our minds for the long run, not for today or tomorrow. We're not going to be able to travel for a while. Things are going to be different for a while. The world is such a small place. I travel every 2 weekends. I'm out of the country because JFK flies anywhere. So it's a nice 3-day weekend. It's particularly hard for me as well, but this is the new world, and we really have to accept it and think forward, like beyond Florida saying, oh, we have 1,000 cases today, or Texas saying we have 5,000 cases. Beyond that, we have to think a little bit further and understand that this is a pandemic, and the word pandemic really has big consequences. And I feel the faster people understand that and trying to change your mind, to your thoughts, to say, how do I survive this pandemic? And I think talking to each other is very important. If you can meet up with people, get a Zoom or FaceTime or whatever, keep talking to people. You mentioned the depression thing, very, very concerning. But I want people to prepare for the long run. I think once people realize this is going to be a while that we're fighting this, it's a lot easier rather than saying, well, could this be over tomorrow or the day after? But conditioning one's mind to say this is going to last for a while, I think will make it easier.
Fair enough. Well, you've been helpful on this show. Also on my last show, we'll probably, if it works for you at some point, come back again. You're out. I'm going to say again, the name of your charity is chirage.com.
That's correct.
And people can go there to check out what you're doing. I appreciate you being out and helping and doing what you're doing and taking care of the patients, and also just being a spokesperson for someone in the medical community to give us some information so we understand what's going on. It's very appreciated.
Keeping the public informed is the most important thing. And, I really welcome opportunities like this to be on your show. And thank you for having me.
Thank you, sir. Dr. Rajeev Fernando. The guy was great on our last show. I thought he was great there. Really trying to stay out of the politics of this, to be honest with you. Trying to stay out of it, trying to get to the bottom of what it is, trying not to go. And I'll tell you something that I've learned. Learned. What I feel, I'll tell you my opinion, especially having read now and watched what's going on. There is politics being played into the coronavirus. I'm trying to stay out of it, but folks, there is no question in my mind. If I'm a Democrat, I am absolutely interested in harassing President Trump as much as I can before this election. And one of the ways to do that is to keep the economy messed up, keep a lot of problems going on, the spiking. And I am not saying that there's Democrats out making people spike or anything like that. I'm just saying that if you were in the Democrat shoes, if you're a Democrat, let's just switch it around. If there was a Democratic president in place, the Republicans would be doing the same thing, because here's the facts. If you go back in time, looking at presidential elections, those times where you have the economy doing well, the incumbent, that president who's in office, Republican or Democrat, usually I think 80% or 90% of the time wins. So the economy, it's important that the economy is doing well at the time of the election in November. Any November when there's a presidential election, it's huge. And of course, Donald Trump and the Republicans know that. And of course, the Democrats know that. This is the game. The game is, and I got to tell you, it took me a little while. I'm not the first person to go, oh, it's all just politics. I don't think this is all politics at all, but it's here. It's part of the playing field now. So there's no question to me that the Democrats are going to do all they can to make, I hate to say this, make sure that the economy is not great in November. I don't even know if they could. I don't know if it would anyway. But there is going to be that intention. And if you're a Democrat and you highly disagree with me, please write me at heysean@seanburke.net. I'm not trying to take sides. I'm just saying if the Republicans are on the other side, they would do the same thing. And I think it's unfortunate. My biggest concern is we got to get businesses going again. We got to get businesses rolling. We're losing. There was an incredible article Yelp put out, because they have all those businesses, how many shuttered temporarily and how many businesses decided to quit. There are millions of businesses in the end that will quit. Restaurants, nail salons, gyms, you're going to have movie theaters. We've talked about this before, and I'm not trying to be negative. I'm just saying we've got to get things going. And that's why I have this show today with Dr. Fernando, is we've got to have some balance. We can't protect every single human in the United States and just shut everybody inside. But at the same time, we certainly don't want spiking of deaths. So we know that the extended health care, the old folks homes, they call them, or long-term care for elderly, 42% of the deaths in the United States, per the New York Times, comes out of those facilities. So we protect those facilities. We use the proning. We use the different drugs, the steroid. Hopefully we catch it sooner. We do the different oxygenation versus the intubation. Can we get this death rate down? Because folks, we got to get going. This can't just go on. All right, that was Dr. Rajeev Fernando, good guy out of Long Island. He is an MD, an infectious disease expert. My name is Sean Burke. This is the Sean Burke Show. You can find this video, if you're watching video, on YouTube, and also on my Facebook page. And also I'll send out a link of this show that it goes out. So I'll put the link in there for YouTube. Also, I'll put the link in there if you want to listen to it as a podcast, if you want to share it with others. Go to seanburke.net. You can also find it, subscribe to it on Spotify, on iTunes, on Stitcher, all sorts of places. If you want to have this show dropped into your email box with all the appropriate links, go to the website, seanburke.net. Over on the left, you can fill in your email address. That's what I use it for, is just to send this out. Okay, that's it for today. Hope this was helpful. We'll really be interested in your thoughts and feedback. You can always email at heysean@seanburke.net. It's also exciting, just for those on the radio side, we now have WSMN. Sometimes my mouth doesn't always go with me. WSMN 59 AM is now simulcast out on 95.3 FM. So good job to Bob and George at the station, the owners, for working that through, because that was expensive. took a lot of work through the right authorities, and now the station and this show and other shows that are on the station have a much bigger reach. So thanks to those guys. All right, it is an interesting time in our life. Let's keep going. Do help people. I like that he said to talk to people. Make sure your neighbors are doing all right. Make sure your friends are doing all right. Just keep communicating with others and helping. We're going to get out of this, and also definitely stay safe. Talk to you soon. Bye-bye.